This is Elias walking you through the steps of visual acuity examination at NEAR. Either have English or English letters or Urdu letters. So I like this test a lot because it distinguishes between malingerers. Now the way to catch a malingerer is that you're going to do this test at 14 inches or 35 to 40 centimeters. The patient can read no line on a distant visual acuity. They should not be able to read any line here. However, if his visual acuity at distance is 20/40, then he should not be able to read beyond 20/40 here. So if he reads 20/40 at distance or at near reading 20/20, that means there is some discrepancy and he is malingering. To do this test, you can either put the patient in a trial frame. The patient does not have presbyopia, which means he does not require glasses for near. Then we will not require him any lenses to be placed in the trial frame. So we use an occluder to occlude the left eye and then give him the near vision chart, which should be ideally at 14 inches, but I usually like to hand over the near vision chart to the patient so that he can keep it at his comfortable distance. And then I'm going to ask him to start reading one letter from the top line.
K.
And then I will ask him to go all the way down.
C, H, O, R, S.
So when he reads the S line, now I'm going to ask him to read this line horizontally.
N, V, S, O, K.
So he's been able to do 20/20 or N6 or 6/6, whichever way you want to write that down. Then I'm going to take the occluder and move it from the left eye to the right, and then ask him to repeat the test starting from the top line
K,
and then go all the way down vertically.
C.
So now if this patient is above a 40 or above a 60, so depending on what his reading correction will be, I will put that in the trial frame. So let's assume this patient is a 60 requiring a plus 2.5 to a plus 3 trial lens. So I will take the trial lens of a 2.50 and put it in front of both eyes, and then once again occlude the left eye and ask him to read it again starting from the top, and then he goes all the way down to the 20/20 line, which is an S, and then I'm going to ask him to read it horizontally. Then I'm going to take the occluder from the left eye and put it on the right eye and ask him to repeat the test. And this will be denoted at near visual acuity of, you can denote it as 6/6 or 20/20 or N6 if he has been able to do it. If he has not been able to do it, then we will denote it as whichever line he's read, so about a 6/12 or a 20/40 or an N10. Thank you.